Hello guys, welcome back to my channel Ages Kingdom. In this class, I would like to take the topic on documentation and reporting, and it's a topic from Nursing Foundations for first year B.Scs and first year GNMs, and it is a repeatedly asked question for 2 marks questions like define documentation, define reporting, types of recording, types of reporting, and regarding Sophia full form, all these type of questions are coming from this unit, and it is several times asked question, define documentation and what are the principles or elements you follow in documentation and reporting. Sometimes they have asked 5 marks questions like types of documentation, types of reporting. So this unit, if you listen, you can answer almost 10% of the questions from this unit. So let's move on. So, documentation and reporting. You will see in the movies the nurses are writing something in the book or the case sheet or the patient record. Recently, they have started saying about patient record or the client or case sheet. And when you see in the government hospitals, we will use the word case sheet. So continuously we will record something, we will write and we will report to the doctor. Something we will write in the case sheet, something we will write in the case notes. Some plans we will do in the cardex and some plans we do in the nursing care plan. And these kind of things all are happening at hospital setup, that is we call it as documentation, something we are writing, something we are writing in the healthcare setup for the purpose of the patient care, for the documentation. So that's call it as a documentation. And sometimes without writing and without recording anything, we will just report to the doctor like the patient condition is so and so, or patient we have given this medication, or patient we have given nebulization, and patient is oxygen saturation is below 80, that's why we have given oxygen. These kind of oral reports or oral presentation we will give to the healthcare professionals, that we call it as reporting. I hope I give a brief explanation about what do you mean by documentation and reporting. Let's move on to the topic in detail. What do you mean by documentation? And so when we see when we see about these words, we report or we document in the healthcare setup in different areas. In different areas like medicine, in case of diagnostic investigations, or in case of any care or supervision or any uh, catering. So the any areas we are communicating and reporting. Suppose a patient required a salt restricted diet. In that case, we have to even communicate to the even catering or to the kitchen that this patient is required salt restricted or patient required a sugar restricted diet. So these kind of modifications even we can send it to the documentation or through reporting. Okay, so we'll see what is documentation. Reporting and recording are the major communication techniques used by the healthcare providers. Recording is nothing but call it as a documentation, or recording also we call it as a documentation, and it is the best communication method we are using in the healthcare setup. So, documentation serves as a permanent record of a client information and care. I think this is very, very valid and useful, especially when we are claiming any insurances or when we are claiming any death claims or like accidental deaths or any emergencies. This documentation really serves as a legal purpose for most of the clients. Documentation is a permanent record of a client information and care. Reporting takes place when two or more people share information about client care, either face to face or by telephone. So here we are conveying some information between different departments or within the department when changing the shift. Nurse to nurse, this patient is like this and you need to monitor, you have to give oxygen. So those kind of information sometimes we do orally within the department or outside the department, with the medical professionals, with the pharmacist department, with the nutrition department, or with the laundry department. Sometimes we will convey the information maybe face to face or through a telephone. Let's call it as a reporting. Then documentation, mostly it is an interaction between and among the healthcare professionals, clients and their families, and healthcare organizations. So this documentation or a written evidence is really helpful in healthcare professionals. So it will help to understand how much the nurses are doing the service, or how much the doctors have planned the care for the patient. These things we are understanding through documentation purpose. And administration of tests or procedures or treatment and client education, what are the things are going on, everything can be is seen as evidence in the documentation process. The results or the client response to these diagnostic tests and interventions. So like this we will do the different kinds of uh, purposes. We are using this documentation as a communication purpose. So the first, we will see why we have to maintain this documentation or reporting. The first main purpose which is happening in the healthcare setting is communication. So you can understand very clearly here, most of the healthcare professionals are, when we use any documentation, this is really helpful when the patient is inside the hospital. It is helping for the communication within the departments and outside the departments. Suppose a pharmacist comes, then she will understand what medications the doctor has written for the today, or what doses have changed. So this is main purpose in the healthcare setting is communication. And second purpose, already I have mentioned, this is used even as a legal evidence. Suppose a person was died with some poison intoxication, or a person has died due to accident, or a person died with a natural death of heart attack. These all declared in the hospital setup, and when we recorded these evidences, they can use it for the legal purposes, they can use it for the claims or insurances or paying any kind of bills from the companies. So that's the second purpose, is legal documentation. And the third one is research. It's really helpful in most of the researches, that especially regarding when we want to study effectiveness of some drugs, because there are clinical trials are happening, and the drugs will be administered to some group of patients, and that group of patients are evaluated whether the problem has solved, or whether problem is remaining the same, or problem has increased. These kind of things they can evaluate by seeing the patient record. And the fourth one is, really it is helpful in statistics. And in so many websites we will see, during COVID time this many patients are died with heart attack, this many patients are died with after COVID complications, this many patients are completely died with COVID. These kind of statistics we are seeing in the government websites or in the private websites of the census. These all things were got through the patient documentation only. Documentation. And the fifth very important purpose, we can see in the medical college attached hospitals, most of the time these patient records are help for the education also. These health documentations and the case evaluation and case studies, when they are studying, they gain the knowledge. They gain the knowledge, like what kind of treatment can be given, what kind of problems are there. These things can be understand and learned through the documentation of the patient records or the client's records. So these are the main purposes of the documentation and recording. The first one is communication, second one is legal documentation, third one research, fourth one is statistics, and fifth one is education. So this is a very important question, which is you asked for 2 marks questions, or sometimes even the 5 marks questions. And remaining topics we will discuss in the next class.